Good afternoon, everyone. Good afternoon. Please have a seat. Good afternoon. It's a room full of leaders. Well, thank you, everyone, for being here and for all the work that you have done leading up to today. I want to thank, of course, our nation's champion, President Biden, for your leadership and commitment to lowering costs for working families in every way. And thank you to all of the members of Congress for the work that you have done and continue to do to help us achieve this type of progress. So we are here today with the firm belief that in the United States of America, no senior should ever have to choose between whether they are able to fill a prescription or fill their refrigerator with food. But for you, yes. Yeah. Because we know for years, far too many of our seniors, millions of our seniors across the country have struggled to afford their prescriptions. And too many of our seniors risked their health as they may have delayed to refill their prescription, or they cut their pills in half to try and stretch out the length of time that they could take their medication. So since we took office, President Biden and I and our administration has taken historic action to cut the cost of prescription medication for our seniors. We capped the cost of insulin at $35 a month. Yes. We will cap the total cost of prescription drugs at $2,000 a year. And we have made vaccines free of charge, which will save seniors hundreds of dollars every year. Yes. And we finally allowed Medicare to negotiate the price of medications with big pharma companies to the benefit of 65 million Americans at least. And as many of you know, we've worked together. Over the course of my career, I've seen the stakes of this fight firsthand. When I was Attorney General of California, I met with countless families who are often quietly suffering because they or a loved one could not afford the medication they needed and were prescribed. I investigated drug makers that tried to stop production of cheaper, generic versions of their drugs, and we held them accountable. And we intervened in the merger of hospitals that could have resulted in less competition or increased cost for their patients. All that to say, there are many factors that drive up healthcare costs and make medications more expensive. And President Biden and I will continue to use every tool at our disposal to bring these costs down. And we will hold accountable those who try to put profits ahead of the health and well-being of the American people. And together, we will continue to build a nation where every person, not just the wealthy or well-connected, has the opportunity to thrive and can live a life of dignity after they retire.